Hello, everyone. Welcome back. Once again, just joining, letting everybody know that my name is Tina Costa, and I am one of the directors with the PHSA Office of Virtual Health. I once again will be your host for this virtual session, and it's my pleasure to welcome or again re-welcome you to the 2023 BC Digital Health Forum inspired by Canada Health InfoWay's Digital Health Week. For those of you who are joining into our virtual circle and may not have been here in the morning sessions, we encourage you to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations. May we all take pause to honor their connection to this land, for their stewardship in caring for and nurturing these lands for all time. And let us all give thanks for this opportunity to gather, learn, collaborate, and provide care on these beautiful lands. It is with great pleasure that I get to introduce our next presenter, Kim Korfuzan. Kim has been working in the field of mental health and substance use since 2010. Through her background in public health, Kim brings a collaborative system-level lens to her work and enjoys engaging in projects which enable large-scale, meaningful, and innovative change across the system of care. In her current role with BC Mental Health and Substance Use Services, Kim's focus is on supporting the implementation of virtual and digital health initiatives, using technology and innovation to improve wellness and ensure the highest quality of care. Please join me in welcoming Kim for a talk on establishing a virtual and digital health innovation hub at BCMHSUS. Kim, over to you.
Thank you very much, Tina, and thanks everybody for joining. Really appreciate the opportunity. I'm just going to get my slides up here for all of you, and we will get started. So following Tina's lead, I do want to acknowledge that I'm joining today from the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. I'm an uninvited guest on these lands and very grateful to be here and to have the opportunity to live, work, and play on these lands. And I'm looking forward to having the opportunity to share with you today a little bit about some of the work that we're doing at BC Mental Health and Substance Use Services. So just to start off, I wanted to do some level setting and provide a little bit of an overview of the project and the program that I want to speak about today. So this project is actually a partnership between BC Mental Health and Substance Use Services, forgive all the acronyms on these slides, TELUS, and the BC Ministry of Citizen Services, their telecom office. Through that partnership, we have been able to obtain funding through something called the Strategic Investment Fund, which is a partnership with TELUS Health that gives us the opportunity to leverage some of the work that TELUS does and some of the resources that they have in order to advance innovation priorities within our different program areas. For this work, we're also partnering with the BC Mental Health and Substance Use Services Research Institute, as well as an evaluation consultant. And the reason that we're doing this work is that one of our key pillars within our virtual and digital health strategy at BC Mental Health and Substance Use Services is focused on sustaining and developing new and innovation. And so this project, as I hope you'll see in the next few minutes, and through the course of the presentation today, is really an opportunity for us to build some of that innovation into the work that we do, learn from it, and see how we can make it sustainable across our various program areas. And so the other piece that I wanted to just highlight is some of the work that we do, and one of the programs with our kind of our flagship program where we've been focusing some of our virtual and digital innovation work, which is called the Redfish Healing Center for Mental Health and Addiction. This is a brand new site that was custom built and opened just in October of 2021, so it's quite new. It replaced what, if some of you know our old BC Mental Health Services, it replaced what was called the Burnaby Center prior to 2021. And so it's a new state-of-the-art provincial 105-bed inpatient facility, and it provides quaternary care for clients in BC with mental health and substance use challenges. So we have clients at Redfish who typically stay with us for several months as inpatients, and again, we're serving some of the clients with what we call concurrent disorders, which is really that co-occurrence of mental health and substance use challenges. And typically these are clients that are experiencing fairly severe and persistent mental health and substance use challenges, hence the need for really specialized service and wraparound care in some of our inpatient programs. And so in terms of some of the the project goals and objectives for the Virtual Digital Innovation Hub, so the hub itself, again, we intended for it to be kind of centered at the Redfish Healing Center, but as you'll see through some of the projects that we're going to be talking about, we do have the opportunity to build and expand the work that we're doing in this innovation space across our various different program areas. And the idea behind the hub is that it would be an opportunity for us to pilot, assess, evaluate, and look at how we can scale pioneering technologies that ideally support our clients with concurrent disorders and improve the quality of care that we can deliver. And so there's a number of different components of the project. The first was to design and validate a virtual or digital health innovation framework. And essentially what this is both a process and a toolkit that allows us to assess new opportunities, prioritize them, and decide on which ones we're going to move forward with. And so we needed something that was really going to walk us through that process and ensure that we were being really comprehensive in our assessment of new innovation ideas. The second piece is around, once we know what those innovation ideas are, to identify some virtual and digital care innovations that enhance the quality of care for clients and also that contribute to the body of knowledge and literature about the use of technology within our very specialized client population. So one of the reasons we were inspired to do this work and to make sure that research was such a key component of our project was that we recognized that there was quite a dearth of literature out there related to clients with serious and complex mental health and substance use challenges and how technology could support them in their care. There is obviously lots of emerging work related to virtual and digital health, but it does tend to be more focused on clients with mild to moderate mental health and substance use challenges. And we were seeing not a lot out there for our population specifically. And so we're really invested in using this opportunity as a way to contribute to that knowledge, that body of knowledge. And so next, once we've identified what some of those digital care innovations could be, the idea is to prioritize those and then start to implement them as pilot projects. The intent is to assess their effectiveness based on evaluation and research data. I mentioned, the BC Mental Health Research Institute, as well as the UBC Brain Lab, both of whom we're partnering with to do this work. And then for technologies that prove promising, the idea, again, we're still early in our implementation, so we haven't gotten to this stage yet, but the idea would be that if we find technologies that prove promising, that have good evidence to support them, then we would build business cases and implementation roadmaps to look at how we could support expansion and sustainability as appropriate. So just a couple of extra words just around our virtual and digital health innovation framework. So the framework comprises both a process and a toolkit for identifying and assessing the viability of new technology opportunities. And in addition to supporting this particular innovation project, the idea was that we would use some of this funding to develop this framework, knowing that the funding for this project is time limited, that this framework would be something that could sustain beyond the funding that we have for the project and actually give us an opportunity to apply it to other opportunities in the future and to make it something that's really repeatable. And so that's the idea behind our framework. And so some key considerations that we included within the framework were things like, how does the technology that we're proposing impact both client and staff, either their work or their impact on their health? How does it align with our strategic priorities? What types of technology options are available and what do we know about those technologies? How leading edge are they? And is there any, preliminary evidence to suggest that they would be successful in this type of environment? What's the research and evaluation potential? I alluded to this earlier, but really wanting to make sure that we're contributing meaningfully to the body of knowledge around this work. And then also very important is things like future scalability and sustainment. So what are the costs of these new projects? How easy are they to introduce into our environments, and what does it take to actually make them sustainable and scalable to determine what's going to be the best fit for when we have lots of good ideas and we need to prioritize down to a few key ones that we can actually move forward with as pilot projects. So some examples you might be thinking about, well, what do we mean when we're talking about some technology innovation or some digital health innovation that we want to introduce into some of our program areas? And so A few of the types of things that we were originally looking at were things like wearable and sensor technologies. So how could we use wearable devices to track things like client activity levels and sleep patterns, their stress levels, and use some of that data to actually facilitate more early identification and intervention for any symptoms of stress, cravings, or relapse, which of course contribute to a better experience for the client while they're in the program, and hopefully actually put them in a position to be able to move through their treatment journey in a more effective way so that they can be ready for discharge and return to community. We've also been looking at how we can continue to enhance virtual care delivery. Obviously, virtual care is very prominent now and is available in most of our programs. And so looking at, are there ways that we can continue to enhance the way that we're delivering care and the way that we're supporting specialists to consult with one another, recognizing that we're fortunate to have this very high density of specialists in our BCMHSUS programs, but that isn't necessarily the case in other areas of the province or other locations where our clients are being discharged when they return to community. And then another example is virtual reality, which I'll talk a little bit about later, how we're introducing that into some of our pilots. But we know that there's some evidence, some emerging evidence to suggest that virtual reality can be used to deliver exposure therapy for clients with phobias, schizophrenic hallucinations, and trauma. And so we're very interested in the potential applicability for clients served by our programs and whether there's ways that we can utilize virtual reality to, again, enhance the care that they're receiving and help to put them on the strongest path towards recovery as possible. So I'm going to talk about 3 different pilot projects that are currently underway. Again, we're in the very early stages of this initiative, and so we're just for most of the project we're just in the planning phases. For the wearables pilot, we actually just started launching our recruitment today, so it's very timely with BC Digital Health Week happening at the Office of Virtual Health this week. But yeah, so I'll talk to you about just at a high level about a few of these, and wanted to give you an overview of the types of things that ended up getting prioritized and that we're looking at implementing within a few of our program areas. So in terms of the mental health wearables pilot, this is actually, it's one pilot project, but actually has 3 different components to it. Our steering committee, which, as I mentioned, is made up of representatives from BC Mental Health, TELUS, and the Ministry of Citizen Services Telecommunications Office. They essentially approved the use of these wearable devices as something that we were going to pursue through our first pilot project, including the intent to integrate research into this. So we've really closely worked with the BCMHSUS Research Institute and UBC Research to get Clinical Research Ethics Board approval to move forward with this work and to make sure that we're approaching it in a way that will allow us to collect good data that we can then use to publish on the results of our study, but that also ensures that we're doing this in an ethical and safe way for the clients at the Redfish Healing Center. And both BC Mental Health and UBC Research have some experience with wearables in this setting, but it was very preliminary, and so this was an opportunity for us to really build on some of the initial work that they had done and to do it in a much more expansive, comprehensive way. So as I mentioned, there's 3 different parts to the wearables pilot. The first one is looking at sleep activity and architecture. So we're basically providing clients with access to an accelerometer through a Fitbit device that measures whether the individual is moving at any given moment, and also has the ability to measure some data around the quality of their sleep and how much time they're spending in different sleep stages, because we know that good sleep hygiene is critical to positive mental health, and that many of our clients at Redfish actually do complain of issues with sleep. And so we're looking to better understand what's actually going on and how we can use the data that we might collect through some of these wearable devices to improve their care planning and some of the treatment options that we're offering. The second piece is around stress detection. So we've identified a device that allows us to measure the electrical conductance of the skin through things like sweat. And so that electrical conductance measure is considered to be, at the moment, the most reliable way to measure stress at an objective level. And we know that stress is often associated with relapse. So this is an area where we're actually very interested in tracking clients' levels of stress over the period of time that they're at our program, to identify if we can proactively identify opportunities to intervene if we do notice that stress levels are getting higher for any particular reason, and that might put the client at risk of relapse. Then this might give us an opportunity to better understand what's going on for them and to intervene sooner rather than later. And then the third component is drug craving biofeedback. Unlike the two other wearables, this is a wearable device that's an EEG, so it's worn around the head. Unlike the other devices, which we're asking clients to wear for a period of time, as they go about their day-to-day activities, the drug craving biofeedback will essentially measure immediate responses to some specific visual cues, some drug and craving related and some not, and use it as a way, again, to measure clients' levels of craving over the course of their time within the program, and again, assess how well the treatment is functioning, as well as whether there's opportunities, again, to intervene early if levels of craving are going up. Again, always with the goal in mind of ensuring that clients are ready to return to community and that we're preventing relapse wherever possible. So those are our 3 different wearables pilots. They're currently all going through Clinical Research Ethics Board approval, except for the stress detection one, which, as I mentioned, we're just starting our recruitment for this week. And just to highlight, I wanted to highlight some of the things that we identified as, some of the reasons that these pilots got selected, both for the clients and the staff. So the idea behind the impact for the clients is that this would give clients an interesting new way to further engage in their recovery process, and also to give them some benefits clinically. In theory, any cliented redfish could be eligible. For research purposes, for the strength of the research, we're targeting to recruit 60 to 80 clients for each of those wearable pilot studies. And ideally, they could participate for as long as they're staying at the Redfish Healing Center. So the sooner we can enroll them, the better, so that we can have as much time as possible to track the wearable data, assuming that the clients are safe and appropriate to be included. So we're working very closely with our patient care coordinators, our clinical teams, our access and flow coordinators, to make sure that the clients that we're introducing to the study are in a place in their recovery and in their treatment where it's safe for them to be able to participate in this work. Obviously, all of the participation is completely voluntary, doesn't otherwise impact the care that they're receiving at our site in any way, shape, or form. And they have the option, of course, to drop out at any time without any consequences. And so, making sure that we're kind of covering all of those basics from an ethics perspective. We've developed a number of protocols and are really ensuring that our protocols for engaging clients are culturally safe, appropriate, and trauma informed. And so we have a number of patient partners, as well as some Indigenous leads, who are helping us to review those materials, ensure that our processes are appropriate, and to continually improve the way that we're doing things, so that we can make sure that this is a safe process for everybody who's participating. And in terms of when we were, deciding which devices to choose, we were looking for things that were minimally invasive, so as comfortable as possible for people to wear. We wanted to accommodate clients that might have lower levels of literacy or cognitive ability, so they could still appreciate what the data is telling them and benefit from that. The ability to provide reportable or dashboard feedback to clients was a highlight as well. And we were also looking for any other features that might incentivize clients to participate, for example, from some previous use of Fitbit devices, that clients like having access to the time and can, set up reminders on their Fitbits, and that was an incentive to participate, in addition to the data that they'd be getting through the wearable tracking. And on the clinician side, one of the key objectives is to understand how access to this type of real-time wearable data can improve care planning and enhance clinical decision-making. And so we have a few different members of the Redfish team who we've engaged with throughout the planning process to see how they would be involved in the project. As I mentioned, our patient care coordinators and access flow coordinators are helping us to identify eligibility and to identify when people are entering and leaving the program, so that we can make sure we're enrolling people at the right time, but also getting devices back from people who are going to be discharged, and doing any closeout in terms of, closing interviews with them and things like that, to make sure we've captured what their experience was like. On a day-to-day level, healthcare workers and nurses are likely going to be supporting a lot of the day-to-day work, and including getting clients to these sessions and helping connect them to our research assistants, who will be on site and who will be there to support them with anything related to the use of the devices. And then we're also going to be, with client consent, we're also going to be having the opportunity to share summary reports with the client's circle of care and their physicians, so that they can, again, have access to that data and use it for their one-on-one discussions with clients about what might be going on with them, as a way to kind of spark some discussion and hopefully open up some of the dialogue around some of the results that they're seeing through these wearable devices and see how that might impact the care delivery or the care planning that they do moving forward. So that's our first pilot. I'm going to move into pilots 2 and 3. These will be much shorter overviews just because we're further behind in our planning process for these. But as we started to prioritize these projects, we tried to fit in as many as we could within the funding and the timeline that we had available. So our second pilot is focused on virtual health in seclusion or segregation units in correctional health services. So you'll notice this one, it's a good example of an area where we've actually focused on one of our different programs within BC Mental Health and Substance Use Services. We've actually moved outside of Redfish because there was a very strong identified need, and we felt like there was an opportunity to leverage this funding and this technology to do that. So some of you may be aware, but BC Mental Health and Substance Use Services is responsible for delivery of healthcare services in 10 provincial correctional centers across the province. Those correctional centers do have access to virtual care and are actually very reliant on virtual care for a lot of the services that they provide. But there are some instances where we have clients who are temporarily in a segregation unit or in seclusion, and for a variety of reasons, some of it being, that they refuse treatment, other times being that they are not well enough to be moved from that area. And so in some cases, they actually have to wait for in-person assessments by GPs or psychiatrists. And typically, again, those happen to be clients that are quite ill and and there's a strong potential for deterioration. And so any delay of treatment, as we know, is not ideal. And the lack of physician availability for those in-person consultations, especially in some of our more rural and remote sites, is a big challenge. And so the idea behind this pilot was that we were going to find a way to bring video conferencing and access to virtual care to the segregation space to facilitate those clients getting care and assessment in a much more timely way, and really minimize the time that they're having to spend in seclusion so that they can be moved to somewhere where they can get more appropriate treatment. And so we've selected a couple of pilot locations and are going to be focusing on the areas where there's the greatest need and also where we have some opportunity in terms of the volumes of individuals who we expect might have this particular need as they're going through the program. And so finally, the third pilot is around virtual reality. I alluded a little bit to the use of virtual reality earlier in the presentation, but again, this has come up as a really exciting, innovative opportunity to see how we could use virtual reality to train coping to triggers. And I'll say a little bit more about what I mean around that. So essentially, what we're looking to do through this pilot is to actually use some virtual reality scenarios to simulate exposure to certain substance use or addiction triggers. Things like being approached by someone who's offering drugs or inviting you for a drink at a bar, and then follow that with some adaptive coping mechanisms in a supportive clinical environment. So the idea being that clients would have the opportunity to practice some of those coping techniques not in a simulated environment. It's not real world, but it simulates what might happen if, once they're discharged and are in community. And so in allowing them to practice, the idea is that they'll be better situated and more comfortable and confident in their ability to use those coping mechanisms once they do return to the community. And so what we're trying to do, again, like many of the other projects, is to reduce the risk of relapse, expose clients to those challenging situations in this environment, and again, to do it in a way where we have mental health professionals who are there supporting them through that experience, and they would have additional support from their existing circle of care or care team. So again, doing this in an environment where they have all of that support to prepare them for the instance where this happens in the real world. And so given the novelty of this particular pilot, we are intending to approach it as a bit of a proof of concept. Again, use of virtual reality isn't something that has been really widely studied. And so our intent is to start by introducing a generic virtual reality scenario with both some patient partners and some clinical staff to test out the feasibility of the technology. So is it comfortable? Is it something that would be realistic that clients would even be willing to wear for a session like this? And is the scenario and the what they're seeing in front of them realistic enough that this would actually have the intended effect in terms of helping them to train for those scenarios in real life? Phase 2 is to introduce some more mental health and substance use focused scenarios that would be kind of off the shelf. We've actually identified a few vendors of virtual reality that we were surprised and pleased to find had developed these types of scenarios specifically for the use case that we were looking for. And so there's some vendors, particularly in Europe, who have been doing work in this space for some time now and that have developed some off-the-shelf scenarios that very much relate to what we would be looking to build for our clients. And then the third phase could be to potentially invest in some custom development for some substance use or addictions focused virtual reality scenarios that are specific to our particular clients. Again, just depending on what we find in terms of our phase 1 and phase 2 analysis, if there's particular scenarios that aren't captured and that aren't available off the shelf, there could be an opportunity to work and partner with a virtual reality provider to actually develop some of those and create something that's really custom built for the types of clients that we see at Redfish and in our other BC mental health programs. Okay, so just my last slide here is just some conclusions and lessons learned to date. So one of the things we've learned is that introduction of research into clinical settings can be really challenging and time consuming. So, engaging early and often to minimize delays and setbacks is really, really important to the keeping on schedule. Having some clear, effective governance, given that there are so many good ideas out there and we only have limited time and money and people to do this work, it really allowed us to do some thoughtful, genuine engagement of key partners and identify what our priorities were going to be, and also to identify who our key clinical champions would be to make sure that this could be successful, or that we're hoping will be successful. Again, we're still just starting out. And then lastly, that innovation does require a certain measure of risk tolerance. So the reality is that we're trialing some devices and approaches that may not result in sustainable or scalable results. Our focus has been on, the ethical and safe approach and making sure that that is, at the forefront for everything that we do. But this is going to be a significant component of our learning process around what makes something sustainable and scalable. And it's part of the reason that we want to do such a good job of evaluating this work as we move forward. So I will stop there and just pause for any questions or discussion. I think we have about 5 minutes left. So I'll stop there and pass it back to Tina. Thank you.
Thank you, Kim. Really appreciate you taking the time to share this exciting work with all of us, and really wish you and your teams well on all of your projects underway and those that are just starting. Really highlights the incredible thought and really patient-centered intention that your team has gone and put in respect to developing the Innovation Hub. Really exciting stuff. We do have a couple of questions. I'll just start with one, depending on time-wise, and it really does speak to that mention of scalability that you talked about. And so the question is, as a provincial program, are you considering scalability to other health authorities who also care for patients and clients with mental health concerns and concurrent disorders?
Yeah, absolutely. So I think, and that's, again, to my point around why we put so much emphasis on both the evaluation and the research components of this, is that we really feel like even, there's opportunity for scalability, and obviously our focus initially is on BC mental health programs, but we really think that there's going to be important opportunities for knowledge translation and sharing of the results of these projects that we do definitely see is going to have benefit and potential applicability well outside of BC mental health programs. And so we're very excited and eager to be able to share those learnings as we move forward, and to look at how we might be able to support other areas in implementing similar things if they prove to be promising or successful.
Wonderful. Thank you so much for your presentation, Kim. Again, appreciate your time being here and sharing. I know we didn't get to all of the questions, and so those who've posed them, please feel free to reach out to Kim and to connect, and so she can answer any other further questions that you have. To end the session, once again, you'll get used to this throughout the whole forum, that we're going to deploy a short poll to gather your feedback for the session. And as we wrap this one up, we'll quickly be moving into our next session, which is entitled Partnering for Progress, a collaborative journey to procure a provincial remote patient monitoring solution. I'll repeat myself again that you can navigate to the next session using the panel on the left-hand side of your feed loop screen. And we will see you over there shortly. Thanks again, Kim.
Thanks, everyone. Bye-bye.